So we keep pinning our hopes on the fact that there are new treatment methods for COVID-19. There are some promising medications that appear like they're going to help to keep the death rate low even as hospitalizations surge. Our Anusha Roy checked on the supply chain of those medications in Colorado and found some good news.
As the number of COVID patients sick enough to be admitted to the hospital surge, we asked Denver Health how their medication supply is doing.
Right now, we really don't have any issues.
Treatment has evolved since the spring to using high-flow oxygen, remdesivir, and dexamethasone.
Well, dexamethasone had a mortality benefit, so prevented people from dying, but it also seemed to prevent people from progressing, as you're indicating. So they come in, they require oxygen, you get them dexamethasone, a fewer proportion go on to need mechanical ventilation or intubation. And the same thing for remdesivir.
So it's a good thing production for remdesivir ramped up. And when cases had dropped off, hospitals like Denver Health stocked up. Dexamethasone has been around for a long time before the pandemic.
At present time, we have an ample supply of those drugs. That's always subject to change, and that's a daily thing to watch. And that's really because the entire country is going through this surge, not just Colorado.
The story is similar across the Health One system.
It's true that the majority of people that get COVID-19 don't end up at the hospital. I think what that also tells us is that the fact that our hospitals are filling up means that there's a huge number of people with infections out there right now.
You don't always know who will fall really sick and who is asymptomatic. And when it comes to cost, the average wholesale price for remdesivir, which you can look at as a benchmark, is just over $3,000 for a 5-day course.
If you would say 5 days of hospitalization, that would more than offset a $3,000 cost, right?
Dexamethasone is much cheaper.
It's been around forever. It's generic, so there's multiple manufacturers.
So all of this matters because if you look specifically at Denver Health, they were never in a position where they had to make that incredibly tough decision of what patient gets medication and what doesn't. Even right now, as the hospital is quickly filling up, they have enough medications for the people coming in. That is fantastic. But we also know that this is a very quickly evolving situation, Kyle. So there are a lot of people across the state all keeping a very close eye on supply.
Anusha, one of the biggest questions state by state during the spring surge is who would end up with big bills for this treatment. Where did insurance shake out?
Yeah, so what the standard is right now is in most cases, insurance was going to cover these treatments. A doctor, though, has to sign off saying it's medically needed. The insurance company has to say, yeah, I agree with that, and then you're going to get coverage. But the thing is, your out-of-pocket cost, that's very much going to depend on what kind of plan you have. So I've said this like a million times, I think. Just check what your plan is. And a lot of insurance companies have actually waived their cost shares for COVID-19 treatment as well. So hopefully that'll be a little bit of guidance and helpful for people.
For sure. All right, reporting live from the Brick House, Anusha Roy. Thank you.